India today has a huge opportunity in its healthcare system, an opportunity that arises out of the multiple challenges that plague that sector. But on the flip side, the story has also been a case of missed opportunity. While there has been a sizable increase in healthcare outlays, it has still not translated into benefits for the poor, who still face the burden of expensive medical treatment, or worse, no treatment at all. Though efforts are being made to move closer to the rural patient, the endemic structural problems like the absence of adequate infrastructure in these remote areas still need to be addressed. So Kiran Mazumdar-Shaw, one of the best-known names in the industry, sets out to find the answers with some of the best thought leaders of the country.
Hello and welcome to India's Healthcare Challenge with me, Kiran Mazumdar-Shaw. This episode features India's very well-known surgeon and entrepreneur, Dr. Devi Shetty, who has been a pioneer in creating a very affordable cardiac care institution, the very well-known Narayan Hrudayalaya Hospital in Bangalore. Over the next 30 minutes, Dr. Shetty and I will actually be brainstorming about his vision for how we can build an affordable healthcare model for the entire country. Thanks, Devi, for coming on this show and agreeing to share your thoughts on how to build an affordable healthcare system for this country. I know that you've been so passionate about making healthcare a right for every citizen in this country. And I know that you're so passionate and committed to delivering affordable healthcare. And you've got this wonderful concept of health cities, which is again driven by your passion to build this affordable healthcare model. So, why don't you just talk about it and let people understand what this whole model is based on?
We believe that in India, if you want to transform the way the healthcare is delivered, you have to concentrate on the number. I'll give an example. India has to do 2.5 million heart surgeries a year. And we are currently doing, all the heart hospitals in the country put together, only about 90,000 heart surgeries. When are you going to reach that number? How many 200-bed hospitals you need to build to reach that number? So we have to really look at a different model.
Now coming to that, I also want to slightly sort of shift that focus because, over time we've tried to develop a kind of, at least the government structure has been to develop a hub and spoke kind of model where you have primary health centers feeding into sort of secondary and tertiary healthcare centers. But you know that the government hospitals are not like the health cities that you've talked about,
Yes.
Now, in that, do you think that there is a good public-private partnership model that can work?
It is happening, Kiran. It's happening in a very large scale. Typical example is Yashaswini we started 8 years ago. We believe that as the time passes by, government will become a health insurance provider, not a healthcare provider. Currently, they are trying to offer healthcare. Instead, if they concentrate on offering health insurance like Karnataka, Yashaswini, Arogyashri of Karnataka, in Andhra Pradesh, the Rajiv Arogyashri, in Tamil Nadu, Kalangar Insurance. And we are currently helping about 6 state governments to launch this low-cost health insurance.
The micro health insurance.
Exactly, micro health insurance.
I think that's such a wonderful model.
Yeah, what we have done, Kiran, together with the Biocon Foundation, Arogya Raksha Yojana. So similar programs are going to prove to the politicians that the best gift they can give it to the citizens of the country is a health insurance policy, which will allow them to access high-tech healthcare with dignity. This transformation is going to happen very fast, and politicians are going to understand the power of giving health insurance. When that happens, the floodgates are going to open. And I am convinced that India will become the first country in the world to dissociate healthcare from affluence. We will have a similar scenario like what we have with mobile phone. 10 years ago, none of us thought that a beggar can have a mobile phone. Today, everyone has a mobile phone. Similarly, everyone will have a health insurance sponsored by the government, and that will really change the way the healthcare is delivered.
What an interesting concept you've just talked about. That is about the government not really seeing itself as a healthcare provider, but a healthcare insurance provider.
Exactly.
And I think that is going to be a very powerful model. And I think what you're then, saying is that the private sector has to then build the healthcare delivery system, where the private sector then has to play that role of providing that healthcare, but supported by the government in terms of assuring reimbursements. But again, we have to make sure that we don't make the same mistakes of the West, because even in the West, the government does provide the insurance mechanism, but suddenly they find that they've bankrupted themselves, because suddenly healthcare has become very expensive in the private sector. So we do have to guard against that.
Exactly. Kiran, the strength what we have in our country, unlike in the Western country, we produce the largest number of nurses in the world. Outside USA, we have the largest number of US FDA approved drug manufacturing units. Soon we will have more drug manufacturing units in India than in US itself. So these are our strengths. And if there is one country which can radically transform the way the healthcare is delivered, making it affordable, democratizing healthcare, is India. Its sheer size and the numbers.
So for India, the strength lies in its numbers. But to convert these strengths into a viable healthcare system that supports the demands of its people, it is essential to connect all the dots. Dr. Devi Shetty, one of the country's most well-known and leading heart surgeons, is a man with a mission to bridge the gap between quality and affordability, something which he has achieved through his health city, Narayana Hridayalaya, a haven for patients from all walks of life. But the fact remains that many patients still have to travel miles to get that even most basic of treatments. It's a problem that many in the healthcare business are cognizant of, and their collective efforts can go a long way to make sure that no patient, no matter where he is, remains untreated. In this special series, Kiran Mazumdar-Shaw meets some of these care providers to find solutions that will shape the contours of our healthcare industry.
These sort of series that I'm trying to host for Bloomberg is really to make sure that we brainstorm about all these wonderful ideas, but then most importantly, we do have to deliver on these ideas.
Yes.
And we have to implement them in a very optimal way, because otherwise they will all remain wonderful ad hoc ideas, and we will be doing things in bits and pieces and not really gaining the real mileage and the benefits of what this powerful ecosystem has to offer.
Yes.
I also want you to really share with the viewers what this whole ASHA workers movement is about, because I know you've been very, connected with that movement, and I think that's also another powerful way of expanding the kind of human resource infrastructure in the rural areas.
Kiran, 60 to 70% of our country's population still live in rural India, where there are no doctors, and their literacy rate is not very high. If you have one of the village ladies, young ladies, who's taught how to manage normal deliveries, how to identify diabetes at an early stage, how to diagnose psychiatric illness at a young age, she is an asset for the village. And since she belongs to the same village, she is one among them. So she is helping her own neighbors, friends and relatives. So all we do is to conduct a training program, a structured training program, which is sponsored by the government at our institution for about 1.5 to 2 months.
And how many people have you trained so far?
We have trained over 45,000 people, Kiran. Yeah. The target is to train a few million of them, because these are the first level of healthcare providers in rural India. And we are very excited with the outcome. Now we are working with them to develop handheld devices for early detection of cancer. Kiran, after heart, cancer is going to be the biggest problem which is going to play havoc in the healthcare delivery of our country. And when cancer starts, it takes about 10 years from the seed is sown till it becomes a full-fledged cancer. You got 10 years of time where you can detect this problem. If these ASHA workers are taught how to detect cancer at early stage, because in our country, nearly 40% of the cancers are head and neck cancers, which is obvious, which can see it. So there are many, many things what we can do with them, and these are a very, very important components of healthcare delivery in a country like ours, where distribution of healthcare specialists is very uneven.
And as you say, early diagnosis means that the whole cost of healthcare comes down.
It's Kiran, if you diagnose cancer at an early stage with a few thousand rupees, you can cure them. You diagnose cancer at the end stage, even after spending few $1 million, you can't save the life.
If we want to bring about a change and reinvent our healthcare system, we need to look at containing the disease at the root. Early diagnosis in healthcare can go a long way in cutting costs, and technology can be the biggest driver in shaping early healthcare delivery. Devi Shetty, a pioneer in using telemedicine in treating patients in remote places, underlines its importance.
You have been someone who's very passionate about using technology, telemedicine, in again, making sure that you connect rural India with the urban infrastructure that we have. And again, that's something, I'd like you to share with the viewers.
Kiran, there are 5 countries in the world which has the capability to put the satellite on the space. And we are one of those countries. We have the privilege of having that knowledge. We get the satellite connection from Indian Space Research Organization. It's called ISRO, free of cost. We are now connected to over few hundred centers in India, and also now we are connected to 56 cities in Africa. In difficult terrains where there is no landline, satellite is the best and the most economic way of communication. Because for the satellite, Kiran, satellite is distance insensitive and it is one-time investment. Using the telemedicine, we have treated over 53,000 heart patients in the last 8 years. It is the largest experience in the world in using satellite for treating heart patients. The beauty of telemedicine, Kiran, is when you hear somebody is unwell, there is 99% possibility that the person who's unwell does not require operation. He requires a medical treatment. Only 1% of the people who are unwell will require operation. That means, technically speaking, you can treat 99% of the patients through the satellite, because you can talk to the patient with a good quality video conferencing. All the images can be transferred. You can see the images. All the blood test reports can be transferred. So, in simple terms, a diabetologist sitting in Narayan Hridayala Telemedicine Center can treat all the diabetes patients in Africa with the satellite link up, because diabetologist doesn't do a procedure. He talks to the patient, he looks at the blood test, and he will advise the patient about the insulin or whatever treatment what is required. This is going to radically transform the way the healthcare is delivered. It is a matter of time, Kiran. Every general practitioner in our country will have a small video conference equipment linked by a mobile phone. If he identifies a patient with the diabetes, he will ask the patient to wait for a minute. He will connect him to the best diabetologist in town, and the consultation happens. If the GP sees someone with kidney failure, he will get the best nephrologist on the other end, and they can talk. Why should a patient travel all the distance and come to the city?
But then again, that tells you the power of technology, because you need to have mobile electronic health records.
Yes.
Right?
Exactly.
I think that's also going to be a very important part of our health ecosystem.
Exactly.
So if we want a health system that's effective, optimal, cost effective, affordable, I think we need to use technology in the best possible way, starting with that whole database that we are going to create using electronic health records, which can be accessible from anywhere, and wherever the patient is.
Yes.
So the mobility of the patient, and yet we need to ensure privacy of the patient.
Yeah. Yes.
All this can be done.
Yes.
Yeah.
Kiran, the technology is pursued by everyone as a tool of the rich people. Using technology, rich people will have what they always had in a better shape. But poor people are going to have something with the technology, what they can never dream of having.
Exactly.
Today, somebody having a heart attack in Tripura, in 5 minutes, he can see me, he can talk to me, I can interact with the family members, I can give the instruction to the doctor, an ordinary MBBS doctor, how to deal with the heart attack. So technology is going to change the way everything what we do, especially for the working class and poor, because they don't have the means to travel. And about the other power of UID, Kiran, what will happen today is that once individual has a unique identification number, this is the single source of the largest insurance program in the world. When you are selling a health insurance for the poor people, unlike other insurance programs, you cannot collect the money in advance from them because villages get money 3 times in a year.
Correct.
So essentially, once they have a number, they can keep on paying their insurance premium in installments. So over a period of 1 year, he would have paid the next year's premium. And because the mechanism will allow them to charge their card whenever they have, maybe with 2 rupees or 5 rupees, whenever they have, in a kiosk or in a post office or any of the kirana shops.
No, I never thought of that, yes.
It is going to make a huge difference.
So the government's unique identification program will empower the millions of Indians without any form of insurance and bring them closer to quality medical care. Aadhaar, or the government's identification program, can open up new opportunities for the healthcare system where giving a simple identity could connect the poor with a public health system or even health insurance. According to Dr. Devi Shetty, in Aadhaar lies one of the prescriptions for success of our healthcare system.
You know, everyone's thinking about the unique identification number, the whole Aadhaar program,
Yes.
to really just look at electronic health records. But what you're saying is it can even enable the whole insurance database. And then you can connect the insurance database with the electronic health records. You can actually create these powerful databases that can talk to each other and from which you can mine very, very valuable data about what the disease mapping of your country is, what resources need to be committed to manage all these diseases. You can actually track patients, you can do wonderful things using all this technology.
Kiran, 3 years from now, when you analyze UID, what it has done to the society, I will take a bet that more than 50% of the UID functions will be around healthcare. Because society doesn't understand how big the healthcare industry is. Global healthcare and wellness industry is a $4.5 trillion industry. US healthcare is $2.5 trillion. And Indian economy is $1 trillion. So I want you to understand that it is a huge, huge industry. It is in a very infantile stage in our country. When this industry wakes up, which has to, because if this industry doesn't wake up, the people are going to suffer. And politicians have realized the power. And more than anything else, Kiran, for a country like ours, which produces 28 million babies a year, we need to create employment opportunities. And today, no industry can create as many jobs as healthcare industry. You look at all the complaints from NHS in England. People do complain that NHS, we are spending so billions of pounds, outcome is not good, there is a waiting list. But they don't realize if NHS closes today, more than people dying because of lack of healthcare, half the British household will lose the job. We grossly underestimate the power of healthcare.
I mean, health is wealth is such an important line in every possible way. It's an all-pervading line. But I think another aspect, I'm going to really sort of, talk about a very important challenge that India has, and that is, we have these very serious problems, the Naxalites, the Maoist problems, a lot of it coming from this whole lack of inclusiveness in what we are doing. Where can the healthcare system play an important role in this inclusiveness?
Kiran, we have a great opportunity to address this problem of social unrest. Like today, 150 districts are virtually controlled by the Naxalites. These 140 or 150 districts have 140 or 150 district headquarters hospitals with 300 to 500 beds. All they have to do is to declare that these hospitals will be made as medical colleges. Once you start a medical college, along with that a nursing and a dental college, in about 3 years, you will have about 5,000 to 8,000 people living in that district, young and restless people, and all it requires is an investment of 50 crore rupees. Now, one of the important jobs we have taken in the Medical Council of India is to encourage all the state governments to start medical colleges. We need to start 100 medical colleges a year for the next 5 years. If we do that, by year 2025, we will have enough number of doctors.
But this is really true out-of-box thinking, because I think these are the kind of innovative concepts and thought processes that we need to engage in and you know, discuss and really drive if we are to solve all these various challenges that we have. Yes. Devi, this has been a fascinating discussion, and thank you so much for, you know, making it so interesting.
Thank you very much, Kiran. Thanks a lot for the opportunity.